Dr. Verghese, for agreeing to do this interview with us today. First, can we just talk about Alzheimer's, dementia? What is it? What are the differences? Some things along those lines?
Well, the one thing we know about the prevalence of Alzheimer's disease is that it is rising exponentially. As someone said, the Alzheimer's tsunami is about to hit our shores. Right now we have about 5.5 million Americans with Alzheimer's disease. It doesn't affect any particular community. It just goes up with age.
And some of the behavioral issues with Alzheimer's disease, as many of us know, is memory loss, agitation, maybe loss of interest in what's going on, surroundings. Did you want to say a little bit about those? Are those the most common?
Well, as you said, everybody understands Alzheimer's disease as losing short-term memory, forgetting what happened a few minutes ago. But what we don't always recognize is that there are many changes in the person's behavior that are part and parcel of the syndrome. The more we know about it, we know that it's nearly universal. Almost all patients with Alzheimer's disease have behavioral problems, and it gets worse as the disease goes on. The one thing to remember about behavioral changes is that they are all very slow and gradual. Alzheimer's itself can take anywhere from 5 to 15 years to fully manifest. And in this much time, the family, the spouse, starts to think, well, that's how he or she is. And they don't relate it to the disease process in the brain.
So say I had a family member who had Alzheimer's. What types of things would I be more likely to see in that family member?
In terms of behavioral changes?
Yes.
Okay. Well, it can be the whole range of human behaviors. Something that's very distressing for family members is changes in their personality. Who we are is written in the frontal lobe, which is right here behind our forehead. That's what distinguishes you from me. People start having more coarsening of their behavior.
So what are some specific examples you can give of some behaviors you've noticed in your years?
Sure. We had a patient who would walk into a supermarket and just pick up candy and walk out without paying for it, or would make hurtful comments like, wow, look how fat that person is. Or, walk into a restaurant and pick up a baby and say, oh, how cute you are. You wouldn't normally do that without knowing those people well, or some of these things you'd never do.
It sounds like people lose that line of where to cross their limits of touching people, things like that. Is there a specific...
Well, it's called disinhibition.
Okay.
You've seen people in frat parties after they drink, you start doing things you wouldn't be doing otherwise. That's because alcohol switches off your frontal lobe and your thinking. So many of these folks with Alzheimer's disease start behaving in a disinhibited fashion.
So it sounds like people lose sight of what a boundary might be when they develop the disease. Do you have specific examples of that?
Sure. What seems to happen is a change in the kind of person they were for most of their adult life. And they start to do things that are quite unlike them, like starting to watch pornography suddenly, or making sexual comments in public, touching people inappropriately. Some people may disrobe in public, or start using foul language, getting aggressive. These are all things that are very embarrassing and distressing. Please note, you can get the same thing if you have a tumor in your frontal lobe, because it changes the way your frontal lobe functions and your personality.
Some of these things don't sound like it's too much of a burden for a caregiver or husband or wife or whoever that person might be. Do you have any examples of where it can become, or a good example to where you see it? It's a burden.
It's funny, we had the recent spate of snowstorms, and I remember meeting with the caregiver, who's the wife, and I asked her, so how are you? She said, we have a snowstorm coming up and I'm going to be cooped up for 2 days with him. A simple thing that you can take on a regular day when you're in a small closed up environment for a long period just wears on you. It's like the water on rock. So he tends to keep asking the same questions over and over again. Can we eat? Can we eat? Did we eat? Did we eat? And this just goes on over and over again, and she just can't deal with it. Do you recall things that some of our patients do.
Yes, one thing that just stands out in my head is a patient who would come in for an interview, and then she'd be in our waiting room, and then her husband would come in for an interview himself. And while the husband was in, the patient would become very agitated, very upset, pacing back and forth because she always wanted to be around him. She looked to him as her crutch, so to
very
speak.
Clingy.
Very clingy, yes. And what are some of the other outstanding behaviors that you've noticed?
Well, sometimes people who were perfectly normal for 50, 60 years can become frankly psychotic. They can start having delusions that people are coming in and stealing things from their house. They can start hallucinating, literally seeing little green men. And this typically happens more towards evening, something we call sundowning.
Now, one of the patients we see, she doesn't enjoy going out with friends, or she doesn't care much about what her family's doing. So what would you say to that?
Well, these could be some of the early signs of Alzheimer's. A withdrawal from the world around, apathy, disinterestedness. What happens is that the world becomes more and more bewildering and confusing when you're losing your memory. So people tend to withdraw into their core space and disconnect from people and the world around.
So when this is happening, are they suffering? Do they know what's going on with them?
Well, early in the illness, it is quite distressing and bewildering. It is very scary not to be able to remember things, not to be able to do the things you used to do. So yes, in mild to moderate Alzheimer's, it is personally distressing for the patient too. But once it goes beyond a point, they get to a point where they don't really know the difference. But anxiety, depression, and distress can be part of this. And some of my patients have talked about life not being worth living, considering suicide. So yes, it can be quite distressing and certainly very upsetting for people who care for patients with Alzheimer's.
So what are the impact on, say, a married 50-year-old couple and one of their parents has Alzheimer's disease? What's the impact on that family?
Sure. How it affects somebody who is relatively younger, in their 50s and 60s, is quite different from a person in their later years. People in their 50s are still working. They still want to keep a relationship in the way it used to be before. They're also looking after their own children, the classic sandwich generation, where you're looking after children below you and parents above you. And they typically show a lot of burnout, where they just cannot do it again one more day. It's not difficult as it is, but having to do it 365 days is very hard. They start losing their jobs, their relationships break down, even their own physical health. There's a lot of data to show that all these areas are significantly affected.
How about when you reach retirement age and you're not working, and then your father or mother, who's 20, 30 years older than you, has Alzheimer's? What happens?
You're absolutely right. You know, there's the very sad situation of the old looking after the very old. You could be 65 or 70 looking after a parent who's in their 80s. And as one gets older, your ability to do things becomes less. You yourself start to have memory problems and physical frailties. If a parent falls down, you can't pick them up, or you might hurt yourself doing that. Many older couples, you'll find that the healthy spouse often is in denial and may even make up stories and fill in for the other person till it's very late, too late.
What about, say, you have siblings on the other side of the country and you're caring for your parent or whoever it might be? How does that feel for that person who's taking all the burden on?
In today's world, people work in different places and move away from the place where they grew up, and caring for people with Alzheimer's disease typically is disproportionately borne by one or the other child. And even within, if it's a husband-wife, the spouse would expect that their children would come and provide some support, which they often don't. So the person who's the caregiver very often feels very heavily burdened or put upon and abandoned by other members of the family.
So we briefly touched on disinhibition, depression, agitation, hallucinations. Do you have a little example that might encompass all of those things, or something, how they affect each other?
Yeah, they generally don't all happen in the same person, thankfully. Delusions and hallucinations. We had a patient who believed that her parents would come and live in the house every night, and she could actually hear them talking in the other room, and she would tell her husband to go and make dinner for them because her parents were visiting, and this would go on day in and day out. In terms of restlessness, we talked about this gentleman who would keep asking his wife for food. Every 5-10 minutes he would want to be fed, and she was afraid he would get sick from doing that. In terms of the disinhibition and change in behaviors, we had an elderly lady who would flash her breasts out in public. In fact, there is a term called depressive pseudo-dementia.
Enlighten me.
Well, what happens when you get depression when you're in your 70s and 80s is that it can start looking very much like dementia. You get forgetful, you get disconnected, you may misplace things and just withdraw, just sit in one place, unmoving, and you can start looking like somebody with dementia. In fact, it's very hard to tease out one from the other.
So depression and Alzheimer's, are you saying it's similar? It could be misconstrued, or it's different?
All of that. In fact, that's what a lot of psychiatrists and neurologists spend their time doing, trying to see, is this just what we call depression, like major depression in regular adults, or is this a manifestation of Alzheimer's disease? Typically what we call pseudo-dementia, which is actually just depression coming up in the elderly. They've had episodes of depression when they were younger, and they feel a lot more distress, and they complain about their sadness. And you treat them with antidepressants, they get better, and it goes away. Sadly, though, many of them in time go on to develop true blue Alzheimer's or dementia, which is hiding under the surface.
So when a caregiver has a loved one who has very disturbing symptoms, what is the progression for that family member?
Unfortunately, once behavioral problems come up, it usually signifies a more severe and rapid form of Alzheimer's dementia. And people with behavioral disturbances may end up needing much higher levels of care within a few years. That is, having to go into an assisted living facility or even a nursing home. As you can understand, having to go into a nursing home is very, very expensive and can ruin that family's finances, and is definitely something that we as a nation cannot afford at this rate.
So in regards to these more disturbing symptoms, how does one go about managing the symptoms or taking care of the person and yourself at the same time?
It's a great question, and that's what's on everybody's mind. What do I do about it? Basically, with any problem, you would think of either medications or non-medication based things. If you have blood pressure, you take blood pressure medicines, or you do yoga and lose weight. So in this situation, when someone has behavioral disturbances, you would think of distraction, redirection, or reassurance. That's very hard to do when somebody is 80 years old and you yourself are in your 80s. Even for younger people, I know of this family where the mother would keep opening the door and let the dog out every half an hour, every 10 minutes. And there's only so many times you can say, "Mom, don't do it. Let's watch TV. Mom, don't do it. This is what happens." And after a point, you just blow your fuse.
So medically speaking, what are the treatments that are available for families, loved ones?
Well, what we do know now is that Alzheimer's can be going on for 10 to 15 years before we actually have symptoms. So the best thing would be if we can prevent Alzheimer's or keep it from going downhill once it manifests. And there's a lot of research going on right now to do that. But once somebody has behavioral problems, you reach for the prescription pad because you need to do something now. If somebody is hallucinating or delusional or aggressive, you can't wait for research. You need treatments now. The sad part is that most of the medicines we use for adults, younger people, do not work well in the elderly. And if they do, the effects are very short-lived and they're very, very susceptible to side effects. The treatment for psychosis is antipsychotics, what you would use for schizophrenia. There's a very much increased risk of stroke and death with that. If you use something like the benzodiazepines, Valium, Ativan, that makes people confused, have falls. So all of these have, very little effect and significant downsides in side effect profiles.
What can families with this disease of Alzheimer's, what can they do to help support research, the medical community in a whole?
Well, this whole area of Alzheimer's disease, just understanding the illness and finding treatments for it, is a global need. And it cannot come from just, governments and companies, pharmaceutical companies. And this is not just in volunteering for a particular study, but being able to be part of this discourse with the government. Literally talk to your senator and tell people that this is something that's important for all of us.